You are listening to the Two Disabled Dudes podcast. I'm Kyle Bryant.
And I'm Sean Baumsart. Together, we're navigating life with disability.
Here we are in front of a live recording, or actually not, a live audience of about 90 beautiful faces. Well, 89 maybe. This is the Two Disabled Dudes podcast, and we're live at Horizon Pharma's offices. Kyle, how's it going, man?
Good, it's going good. I had a few flight delays on the way here, but we were able to sit down together and have a beer last night. It doesn't happen for us very often that we're actually together.
It's a chore. I mean, look at him.
Well, you know, I mean, it goes both ways, man. So,
Fair.
you know, yeah, no matter how much we dislike each other, we still got to do this thing today.
This is true, and we still apparently have a good time.
Yeah. So, I wanted to talk a little bit about why we're at Horizon Pharma. That, you know, we'll talk to a couple of Horizon Pharma employees a little bit later, leadership employees that we'll talk a little more about it. But, you know, there's so much in the news and in the media about big pharma. When you interact and talk and get to know employees of pharma companies and understand their mission, everyone's here to make a difference in people's lives. And that's what I've come to know, and that's why we're here today. Unfortunately, Horizon had a drug in a phase 3 trial last year, and unfortunately it did not meet its endpoints, a drug for FA. And so, you know, a lot of people are like, wait a minute, why are you even at Horizon? They don't have a drug in FA anymore. And it's because we've built a family. We've built such strong relationships, and we'll talk to Rob a little bit later. And Rob, you know, says that you don't turn your back on family, and it's as simple as that. And so, you know, we really appreciate that about Horizon, and you know, that's why we're here.
I think, you know, I'm going to go back just a minute or two. One of the first comments you were making was really understanding the heart of a big pharma. And I really think that's true in life. It's not just the big pharma. It's taking the time and the opportunity to get to know your neighbor or anybody else in any other industry you can think of. When you tend to get to know somebody's heart, then you understand the value that they offer. And every single human being offers some sort of value.
No, but Sean, I think you're right. You know, I think appearances are one thing, but really truly getting to know somebody's heart, like you said, is a totally different thing, and it brings us to another level of understanding and the opportunity to move forward no matter what relationship we're in.
Which is exactly what we've done over the last couple of years with Horizon. So.
Yeah. So the conversation today, we want to talk about patient engagement, and we want to talk about specifically about a few things that FARA and Horizon Pharma have done in the past. First of all, I wanted to give a little overview about what FA is. We've talked about it on the podcast before, and those of you here at Horizon, a lot of you probably know what it is, but in fairly simple terms, FA is a rare neuromuscular disease. You can even hear it in my speech, I guess, right? That affects
Either that or Goose Island. We're not really
yeah,
sure.
No, I didn't have any Goose Island this morning. It affects all muscle coordination from the toes to the fingertips. It also has symptoms like vision loss, hearing loss, and life-shortening heart complications. One of the points that Sean and I are really wanted to make is that you're not seeing the total devastation of FA in the two of us. I was diagnosed at 17. Sean was diagnosed 25. And so we're both 35 now. A lot of kids are diagnosed in their, like, before the age of 10. And these kids are in a wheelchair by the time they're 14. And unfortunately, these kids are dying in their 20s due to heart disease caused by FA. And so this disease is absolutely devastating. Not only rips individuals apart, but families as well. And, that's what we're crusading to change, is to get closer to a cure to change the outcome of this disease for lots of people. And, I know that Horizon was focused on that with the drug that was in trial last year, and is focused on supporting the community now to get us closer. So,
like Kyle said, even though you may not see it in us, it literally is a life and death situation that we're talking about here, and that's why we're so passionately involved and do what we do to bring attention and awareness to this condition, because too many of our friends live a life that's completely jeopardized and too short. So,
yeah. So a couple of other things. It's a genetic disease. So for both me and Sean, both of our parents had a bad gene, and so I got one bad gene from mom, one bad gene from dad, and I was the lucky recipient. And same with Sean and most people with FA. And it affects 1 in 50,000 people. So that's about 5,000 people in the U.S. and about 15,000 people worldwide. So, the NIH, I think it's the NIH, they designate a rare disease as a population less than 200,000 in the U.S. And FA is pretty rare, but, to the individual that has FA, it's infinite. It's the whole world, It affects everything we do. So how did Horizon and Farah create efficiencies that got us to the finish line more quickly? One of the things that I saw was Horizon was at like every single event we did. We had a representative from Horizon.
They're even creating their own events.
Yeah, now they're creating, yeah, exactly. But it truly provided the opportunity for Horizon to really understand the disease. It was, let's get down in the trenches, understand this thing, and so we can more accurately and efficiently move forward. And I think that was probably the overarching big efficiency that Horizon was able to do, was truly understanding this. I mean, at the Atlanta ride, Rod was standing on the corner with his coffee directing bike riders which way to go. And Horizon showed up at our events with their Horizon t-shirts on, and I saw people kneeling down to somebody and truly and having a conversation. You know what? Maybe that conversation wasn't even about FA at all. Maybe it was about, hey, what movies do you like? Or, what video games have you been playing
What's your
lately?
number?
What's your number?
We're both single.
So, but, just truly understanding the disease.
That's what I meant. So we can call and talk about it and get to the bottom of this.
Sean only does the podcast. From the beginning, he was like, I'm only doing this if it's going to help me get a girlfriend. So, and then, I feel like... moving on.
Yep.
Anyway, one of the specific examples that I thought of was for our every year we do a social media campaign for FA Awareness Day, and Horizon made a video about their support for the FA community, and it was the most successful video that we've ever had on social media. And people really appreciated seeing from the Wizard of Oz, right? The man behind the curtain, making these things go. And here he is right here in our community, on our Facebook page, expressing support for the community. And, that was incredibly encouraging, I think, for the whole community, and everyone responded like crazy about that video. That's just one example of the many examples of how Horizon got involved with the community and made their support known. Why is it important to get involved at all? From a patient perspective, disregarding industry and the company for a little while, why do you think it's important to be involved in clinical trials and push the whole community forward? Because I know you've been involved in numerous trials. And what's your thought process? It can be a lot of work and some risk too.
Sure.
Why would you take that risk?
There's a couple different things I think about when I consider a trial, or when I started getting more involved in being a part of the process. The number one thing that I think about is no matter what my contribution is, it's a contribution. And no matter what the end result is, it's still a positive result, because now we know, let's stop heading down that road. Let's do it a little bit faster and a little harder in another direction. So I may not have, I say it all the time, I don't have millions to give to a cause, and I don't know anything about looking at a microscope. I usually look in the wrong end. I'm not
smart.
Is that
even possible?
Anyway, however, I play a role that's irreplaceable. You can't just make up patients. That's not something you create in a beaker or a petri dish. So that is something that it's just your plot in life. Either you are or you aren't a rare disease patient. And being that patient, I want to be involved in trial because I want to be a part of the answer. And I understand that some of the trials I've done maybe are simple, maybe they're just antioxidants, maybe they're not curative in nature, but it still helps us on the journey. And even if I don't see or experience the cure in my lifetime, knowing that I was a part of the process for whoever comes next, that the little boys and girls running around today or who will be running around in a few years, that's an incredible investment that, no offense to anybody that does have millions or knows what to look at in a microscope, it's unbeatable, in my opinion.
Yeah.
That's one thing, and I already forgot the second thing.
All right. Well, for me, I think it's, and I know for you too, it's a source of pride to be able to be like, I made a difference for the whole community. Obviously, like in a lot of these trials, not as if there's a whole lot right now, but we've been in a few. Both of us have been in a few. In an FA patient, I'll go online and I'll enter my name, my demographics, when I was diagnosed, how many DNA triplet repeats I have, whether I use a wheelchair, walk around, whatever, all that stuff. And then when a clinical trial becomes available, then we can, our administrator of the registry can look at the trial and select all the inclusion criteria in the trial and send an email specifically to all those people that qualify for the trial for participation. And using this tool, we have recruited trials in a matter of hours. And I think a lot for rare and common diseases. As a lot of you here at Horizon know, recruitment is one of the toughest things for a trial. Using this one tool, how valuable is that? Those are two things that are not easy to come by.
And the two commodities that everybody wants more of.
Exactly, yeah. And this tool allows us to get more of that, money and time. Holy cow. And so I guess partly this is for any FA patient, or really any patients of any diseases out there that have patient registries. This, I encourage you to register and get involved and, move everything forward more quickly.
In order for, talking to experts mostly in the room, but even for our listeners, in order for a drug to move forward, it's got to be tested. There's got to be some trial, we'll just leave it at that. So we need people like Kyle and I. We need people like you. We need your friends, your neighbors, anybody that might have a condition. Being a part of the patient pool is incredibly important for a drug to move forward, whether it's for FA or cancer or Batten's or whatever their condition may be.
Yeah.
Don't underestimate what you contribute, even if it doesn't have a dollar sign in front of it.
One of these questions that we have for ourselves that we wrote down that Matt so kindly put together for us is, why interact with the industry and with pharma? The answer is shared understanding. I think that's the overall answer, like I was talking about earlier. Understanding of the FA community. And also understanding the other way. But a true understanding, like we were talking about earlier, I think that's the value of getting involved in really.
It goes back to what we were saying right at the beginning. Understanding value and getting to know somebody's heart. So much more can happen when you understand and you're able to empathize with the individuals you're working with or working on behalf of. I'm not in politics, obviously, and I don't know a lot about behind the scenes in the medical world or anything else, but I'm pretty confident that a doctor or a researcher is more inclined to work a little harder or a little more if their heart is connected to the cause, if they have a string somewhere, whether it's because of a neighbor or because of a loved one or whatever the case may be. We get behind the causes that we feel attached to. And part of the reason why patient advocacy is so incredibly important, obviously, is it helps keep moving both forward, research and, patient engagement and involvement.
Yeah, and I think, it works well both ways. Like, patients want to know that they're valued and they want to understand the process, but also I think that to all those pharma executives out there, if you want your employees to work hard, show them a patient. Let them get to know a patient and that person's heart and their desires and their life and what they want to do with it. And you will increase your bottom line. And the time and how hard your employees work. And we want the pharma industry to succeed. We want the pharma industry to make a lot of money because that means we're getting to the goal, right? Helping people and getting our community to the goal. But so it works both ways, both from the patient perspective and it's a really good thing from the farmer perspective as well. But I think really it all comes back to Ron Bartek's founding principle. Ron Bartek is the president of FARA, and his founding principle is collaboration. Get everyone at the table. And, from patients and advocacy groups to industry, academia, government, everyone, all at the table working on this. And if we create a true understanding of each other, and we can all work together and collaborate, we're going to get there much more quickly.
There's a old, or I don't know if it's old, but there's this saying that goes something like the fastest way to get somebody on your team is to get on theirs first.
I like
that. That's exactly what Horizon has done. That's what Farrah continues to do.
Yep.
So, well, I don't know if I'm too soon, but since we're talking about patient advocacy, would now be a good time to invite somebody else to join us?
Yeah, absolutely.
All right. Anybody want to join us? No. Gail Moore, we're going to invite her up to the conversation. You can go anywhere you want. Obviously, she was choosing Kyle first. Did you guys see that? Kyle knows more about you, Gail.
You're killing me. You're killing me here.
No, so Gail has been an incredible friend and partner to the FA community. You know, when I was saying earlier that Horizon was at like all of our events, it was because Gail was constantly on our website seeing what was coming up next and planning interactions and working with the social media crew to get things like the FA Awareness Day thing going, and planning to have Rob stand on the corner and direct bikes where to go and all that stuff. So, Gail, we just really thank you for all your work that you did for the community.
Thank you.
And I say did, but I think I meant to say continue to do for the community. So
it's a pleasure and it's a passion for me. You know, I have two children with a rare disease, and I myself have a rare disease. So it's about giving back, and that's what we're all here for, is to give back and help each other.
Yeah. And so, since you mentioned, I want to ask you a little bit more about your situation, but this reminds me that, you know, one of the reasons we're here is because Horizon supports the entire rare disease community, you know, all of us together. And I wanted to make a little plug. Right now, Horizon has a deal with Global Genes, which is a advocacy organization for rare disease. And if anyone out there, all you got to do is text the word rare to 56512, and Horizon will donate to Global Genes and move the whole rare disease community forward. So I didn't want to forget about that. But Gail, let's get back to you. And
sorry, for the sake of reference, if you go back to episode 6, we actually interviewed Nicole Boyce, the CEO of Global Genes. So an opportunity there to understand what they're all about and what they're doing. So anyway, back to Gail.
Here I am.
So in your experience with rare disease in your own life and in your family, you know, how have you taken your experience and transferred that into your work and into advocacy for rare disease?
Well, you know, initially when you're first diagnosed, there's a lot of shock. And once that shock kind of settled, I didn't want another family to experience the same experience I had. So I kind of buried myself into it. And it was using my energy and, you know, my fear to make something else happen better for someone else. And I started volunteering with the disease state that our family has, and worked for many years bringing educational opportunities for them. And it gave me an outlet. It gave me a passion. And, you know, little did they know I'd probably do this for free. But we won't tell anybody.
Yeah, don't tell anyone.
So anyway, you know, it was giving back, and it was a need to give back, and that helped me grow as both as a patient and as an advocate for our rare disease.
Were you working in this space when you were diagnosed?
No.
So how did you come to work in this arena?
I volunteered for about 15 years with an organization, and one day one of the companies said, "We need your insight. We need a patient inside that can share what the patient's journey's like, what we live with every day, and help them keep the patient first and foremost in their mind. And I've continued to have that experience here.
So it was, in fact, your experience, personal experience with rare disease that led you to this role.
Yep.
Wow.
Pretty cool, huh?
Yeah,
like I said,
that's really cool.
I got to turn a passion.
Is there room for me?
I feel like that's the American dream, right? And, I'm living that dream as well. But it's to put your passion to make a living and to live your life doing what you'd love to do, right? And and it's clear that you do that, Gail. With all my interactions with you, it's clear that you're putting your passion to work for the whole community. So,
well, thank you. That's very kind of you.
If you could put it in one sentence or maybe two, what's the best thing about your job or about what you do?
Oh, that's easy, you guys. I mean, it's being with the patients and especially you, Sean. No, honestly, it's working with the patients. It's understanding and bringing the information back to the company so they can make a difference. And that's what everybody here wants to do as well. They want to make a difference.
So, Gail, what advice do you have for our listeners and anyone out there who has a rare disease and they want to put their passion to work as an advocate for their disease?
I think we all have different gifts and talents, and so find what you're comfortable with. Not everybody's comfortable speaking in front of a group. Not everybody's comfortable organizing events, which was something I was comfortable doing. But find that thing you're comfortable with. It may be just a peer-to-peer conversation, and go to the organization that's representing your disease and offer them what your talent is. We all have a talent, and it may be fundraising. I'm not necessarily the best fundraiser, but we all have a talent. Figure out what that talent is. Figure out, no matter how big or small, it's big to the community. Whatever you do, it's going to be big to your community. And so just give your time in some way or another.
Right now, we want to invite Rob up to talk about some of the interaction between Farah and Horizon. Welcome up, Rob. So, thank you for sitting next to me, Rob.
Yeah, absolutely.
Do you want to come back here? Come on up. All right.
So, Rob, first of all, why don't you just tell us what your title is once again at Horizon?
I'm responsible for global patient advocacy.
All right, and
real quick, I'm sorry, but earlier today before we got going, we asked a couple of people, what's his title? And we should write this down. Nobody could give us a legit, a formal, he's the director of blah, 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 or the vice president of, it was kind of just all over.
Yeah.
And so, Rob, I don't know if you're nervous, but if I were in your shoes, I'd be nervous. Yeah. If I didn't have a real
no
title
one knows what Rob does.
Yeah. Rob, the writing is on the wall.
So, Rob, you were one of the first employees at Horizon. And for our listeners, do you want to just give a short version of that story? Is there a short version?
It can be as short or as long as you'd like. I can just go on and on and on. Back in 2008, a couple of us, Tim Walbert, Jeff Sherman, myself, Amy Grun, in the early days, we met up at a coffee shop basically and decided that we wanted to start a company. That company was known as Horizon Therapeutics, and in those early days, we basically talked about the kind of company that we would want to create. And in those days, I'm a Libra, and so it's all about the balance and the fairness. So I'm a big fairness kind of a person, as were the rest of the folks in the early days. But creating a company that does the right thing, that is fair to everyone possible, to work hard, to play hard. That's kind of, those were our founding principles.
Nice. Less than 10 years later, how many employees does Horizon have?
We have around 1,000 globally.
And so what do you attribute that growth to? Less than 10 years, 1,000 employees. Obviously, you're doing something right.
I think a lot of what we have is culture and a culture of teamwork and transparency and working together and communication. A lot of us come to Horizon from a lot of different backgrounds, big pharma, small biotech, maybe not even in pharmaceuticals, but we're looking for the kind of people that are positive and energetic and creative. And I think that's really resonated. You know, back in the early days when we were working out of a coffee shop or in our first office that leaked, water leaked from the windows, it's hard to recruit someone in from a Takeda of the world or Pfizer to say, oh yeah, by the way, we have co-employment. You need to work for, you're actually technically going to work for somebody else, and we have no 401k, and we work in a dilapidated office. But I think it was the spirit that we had and the conviction and the leadership in the early days, and I think it's translated into who we are in this room as well as out in the field.
Nice, very good. So, what did Horizon learn from the relationship that we built, Farah, and with the FA community in general and in Horizon over the past few years?
I think it probably varies a little bit depending on who you're talking to, but from my perspective, that depth in relationship and true partnership is possible. And by partnership and relationship, I mean, I consider the word partner, I'm going to look out for you. And I know, and I believe that you're going to look out for me. And so understanding the needs of your partner truly in depth helps me address needs and develop solutions. We're in a position where we can help, whether it be in Friedreich's ataxia or other conditions, and so we should.
Simple as that. I love how you boil it down to black and white. We should or shouldn't do whatever, it's so simple and so powerful, and it should be that way. It's simple as that, So.
It's that kind of philosophy, I think, that makes the world go around. I can help, that's what I'm going to do. That's what I should do. So,
yeah.
Thanks for helping.
So why does Horizon remain engaged with the FA community? There was a trial that did not reach its endpoint. Horizon no longer has a drug in FA anymore. Why is it of interest to Horizon to continue a relationship with the FA community?
It goes back to the coffee shop in trying to do the right thing. It has to do with the relationships that we created with the community. And when we talk about the depth of relationships, we were interested in creating those relationships, but you were willing to allow that to happen. And when we continued down the pathway of understanding, not just me, not just Gail, Julie Ball, Jeff Sherman, Amy Gran, I'm going to forget many others.
Everyone here.
Marilyn Vetter, Tim Walbert. It became personal. It became personal. So why we continue to do it is because we can, because it's the right thing to do, and you're a community that we're not going to turn our back on. And it's not more complicated than that.
I think if you boil it down a little further, what I think I'm hearing and what I love about what I'm hearing is that we're not just in it to make money. Not everything is driven by profit, and I'm so thankful that you guys have that sort of mentality.
I think our industry can do a much better job, more thorough job of doing the right thing and not making things always about a return on investment or having some benefit. At the end of the day, it's about, you talked about it, it's heart, it's people. And just because something doesn't work out doesn't mean that you lose the relationship. We haven't seen each other in a while, a couple of months, and it was to me awesome to see you this morning, and so it's a homecoming.
Right,
it's a homecoming.
Thank you so much.
Thank you, Tom.
And thank you, Gail.
Thank you, Sean,
for your contribution today to the podcast. So at this time, we wanted to open the floor. I know most of you probably need to get back to work. Or lunch. Yeah, we need to get to lunch as well. But with a few minutes, I guess, we wanted to open the floor for questions. If anyone has anything they want to ask or discuss. Everybody's like, we're hungry.
Cool.
Thank you guys for today. It was really great to reconnect with you. Can you tell us about what's going on in the FA community with other products and other research? What is your most hopeful target?
So this is how I would answer that question. There are near-term targets and there are long-term targets. So, the goal, sort of our mantra, has been slow, stop, reverse, cure. And that's kind of how we think of it. Like, some of our more near-term targets are, they're not going to be the cure. They're not going to solve all the problems. But then there's stuff like gene therapy that is incredibly exciting. I saw some mice when I was in France a couple weeks ago, and they've figured out how to basically cure these mice. And obviously it's like a big leap between a mouse and a human. But there's absolutely a huge amount of hope behind gene therapy. And so, we're working on a number of different things in our research pipeline. Some near and some a little farther down the road. But the fact is that we're not going to stop. And as you guys know, we're not going to stop until we reach the finish line. That's the fact. So,
Well, again, thank you for being here and for entertaining Kyle and I. I love it.
Thank you.
That campaign that Kyle mentions is a commitment from Horizon to donate money to Global Genes for every text it receives to 56512 containing the word rare. So all you have to do to help increase the contribution is simply text the word rare to 56512. Again, text rare to 56512.
Thank you for listening to the Two Disabled Dudes podcast. Find us online at twodisableddudes.com. And please subscribe and review on Apple Podcasts.
We'd like to hear from you. You can find us on Facebook, Twitter, and Instagram.
Special thanks to our audio producer, Jake Tompkins, who also composed the music.
Until next time, keep living with urgency.